Hepatitis B and C are today becoming two of the most important viruses affecting the mankind. There are a lot of myths about hepatitis B and C. In this short presentation, we'll try to clear some of these myths about hepatitis B and hepatitis C. The first and foremost question which comes to mind is, what exactly is hepatitis B and hepatitis C? Hepatitis B and C both are viruses. These are diseases which are caused by these viruses. They affect primarily the liver. They can lead to fibrosis, cirrhosis, ultimately there could be liver failure, and might lead to even cancers and death in some cases. The second question which comes to mind is, how can I get hepatitis B or hepatitis C? Mostly viruses have this spread through body fluids like semen, blood, and saliva at times. The most common route is through IV drug abuse. Sharing of syringes, needles, this is one of the common factors causing this. An infected mother can transmit this to a newborn child. Again, it can be transmitted through sex with an infected partner. It can spread when you're taking care of some open wound of one of your relatives, when you come in contact with blood, and it can also come when you're using the same razors or toothbrushes. Why it is important to treat hepatitis B and C? The question is very simple. The answer is, hepatitis B and C, they both affect the liver. In due course, the liver becomes diseased, fibrosed, and ultimately the working part decreases. This is called cirrhosis. Ultimately, the cirrhosis can lead to liver failure, liver cancer, and can lead to a lot of mortality and morbidity. Who are the people who are at risk to contact this deadly disease? IV drug abusers sharing the same syringes, they are at risk. Children born to an infected mother carries the risk. Sex with a partner who's already having this disease, this can lead to transmission of disease to the other partner. This can happen in healthcare professionals who frequently handle body fluids like blood and others. It can happen even to hemodialysis patients, in which repeated dialysis can lead to acquiring this virus through the dialysis tubings. How do we know that we have hepatitis B or hepatitis C? Sometimes it just passes as a simple phase. Person might have just flu for a few days. At times one might have muscle fatigue, laziness, body aches, headache, sometimes mild fever, and sometimes the symptoms can even worsen into jaundice. And at times it can have a severe phase in which one can have progressive jaundice and a lot of other related problems related to liver and rest of the organs. And it can be very simply tested just by few blood tests like bilirubin, SGOT, SGPT. So it's not difficult to diagnose this disease, but this has to be done only when symptoms come. But in people in whom there are no symptoms, they sometimes never come to know that they had ever acquired this virus. How can you take precautions to prevent these deadly diseases? Important is not to share syringes, needles, toothbrushes with anyone. Always observe safe sexual practices. Healthcare professionals always have to take universal precautions. They have to be careful handling patients and their body fluids. And the most important part of it all, universal vaccination against hepatitis B can go a long way in decreasing the spread of this disease. Some people ask, can I get protected against this deadly set of viruses? Yes, you can, but only against hepatitis B. There is vaccination available and all of you should be vaccinated against hepatitis B. The only flip side is that if you already have the disease, then there is no vaccination which can prevent this disease from becoming chronic. For hepatitis C, we don't have any vaccination for the present times. So prevention is the best form of cure for the present times. Is there a cure for hepatitis B and C? In some ways, you can be cured of the disease, but that cannot be promised. hepatitis B has a lot of drugs which are active against hepatitis B. They prevent the disease from becoming more deadly, causing more damage. At times, you can be cured of this disease also. In hepatitis C, however, the results are much better. There are different types in hepatitis C. Genotype 3 and genotype 2 can be cured almost to the tune of 80%. Genotype 1 and genotype 4 have an average cure rate of 50 to 60%. That means most people taking the treatment in the form of injections and tablets can be cured of the disease if they take proper medication in the hands of proper doctors. But it cannot be said that you can be 100% cured of the disease. So again, the most important part of this thing is that you have to take precautions all the time so that you don't contact these viruses. Now, if you are already infected, what precautions should you take so that you don't worsen the already existing damage? Most important is that person should not take alcohol at any time. Even in moderation, alcohol can worsen the effect of these viruses. The second most important point is that you should not take any medication whatsoever without the advice of a good hepatologist. And thirdly, your timely tests, timely ultrasounds and some blood tests, they go a long way in knowing the complications beforehand and taking care before it's too late. Should hepatitis B and hepatitis C infected people be prevented to work in certain fields? The answer is usually no. Because hepatitis B and hepatitis C usually does not spread by close contact, it does not spread by working together in a small huddled space. It usually only spreads by sexual practices or by blood or other body fluid contacts. So the person should be free to work in most occupations. So these were some of the important questions which come to mind when you think about hepatitis B and C. The best help you can do for yourself as well as for the society is that try to prevent the disease from spreading, because the disease itself has only partial cure and other people will stay with the disease for the rest of their lives. So prevention remains as the best cure possible. Thank you.